I'm here with Oscar Sitta, and I'm going to let him introduce himself, and I'm going to ask him a couple questions about some careers in psychology.
Hi guys, my name is Oscar Sita. As Shirley just said, I'm a licensed clinical professional counselor, a licensed clinical alcohol and drug counselor, certified problem gambling counselor, and I have my master's in clinical mental health. And I'm be glad to talk to you about any opportunities you might have at the bachelor's level or taking your education further on to master's or PhD level.
Yeah, a lot of our students are they're undergraduates right now, and they're trying to decide whether they decided to major in psychology or they decided whether they want to major in psychology. So if you could just talk a little bit about why psychology would be a good major, or maybe some things about what they could do with a bachelor's in psychology.
So most psychology degrees are psychology, either liberal arts or science, right? And those are primarily theoretical foundations of psychology, which apply to all the different disciplines: social work, marriage and family therapy, clinical professional counseling, psychology, and even psychiatry to a degree. So it's a good start. If you're thinking about just going up to the bachelor's level, there's opportunities for licensure or positions in all kinds of different fields, from criminal justice to direct services with clients, but limited. So let's say, for example, you get your bachelor's in psychology and you want to work as a counselor. Depending upon the state you're in, I'm in Nevada, we have a few different opportunities. You can work as what we call a paraprofessional, as a drug and alcohol counselor, and you can work with individuals who are in recovery from addictions, and that would include running groups, psychosocial groups, psychoeducation groups, psychoprocess groups, and then do individual counseling, treatment planning, and aftercare planning for those individuals. You might need to get some extra training postgraduate with your bachelor's, or you might be able to get onto the job training. A lot of times it happens that way. But this will allow you to be eligible for a professional license. Now, if you want to practice at a higher level, let's say where I'm at, a master's level, a licensed clinical professional counselor, I can work in private practice the way a doctor or a marriage and family therapist can. So this takes, and these master's degrees tend to be from about 60 to 70 credits past your bachelor's. So it takes a couple of years, maybe 2.5 years if you're going full time. And there's also a number of licensure requirements, exams too. So post-graduation, you'll work in the field, but you'll also have to take a few licensing exams to get fully licensed. You'll have to carry liability insurance, just like a doctor would, because to make sure all your treatment is ethical and evidence-based, and you're responsible for the patient's care. So there are a number of responsibilities, professional, ethical, and otherwise, that you have to adhere to. If you want to go on, and let's say you're interested in becoming a psychologist, and a lot of misconceptions are that psychologists are therapists. While psychologists can do therapy, the majority of what they tend to do, that's kind of like overkill. It's like hiring, let's say, a professional police officer to be a security guard. Psychologists, because they're actually scientists first and clinicians second, a lot of what your training is going to be is how to become a scientist in the psych field. So while they have clinical licenses, they tend to be very different in terms of the way they approach certain things and practice. And they also have the opportunity to do really complex assessment and treatment planning. So you'll see them, like, for instance, I'll work with a psychologist that has somebody with, let's say, severe PTSD and maybe a neurological disorder. So they can give me their report, and I can use interventions that will help develop skills and or coping for the client. And I might send them back for a reassessment. But they don't tend to do just straight therapy. Those assessments cost between $1,500 and $2,000 in Nevada. So you could see how they might be able to better use their time using those assessment skills rather than doing therapy. And that could take anywhere from 6 to 7 years to become a psychologist post undergraduate degree. So it's something you want to make sure you're really passionate about. I think a lot of people try to find something they want to do, but they're not really sure what it is. And that can lead you to kind of backtrack in the middle of your program and say, well, this isn't really what I thought it was. So it's really important to do research up front. Talk to people who are actually in the field, ask them what they like about it, ask them what they don't like about it. I'll tell you personally, for me as a therapist, what I hate is doing paperwork. It is not my favorite thing to do, but it's a necessary part of the job. You do lots and mountains of paperwork. I probably spend, when I was in full-time practice, at least 20 to 30% of my time doing paperwork and the other 70% seeing clients. But that's how you get paid. Also having to deal with insurance companies who don't necessarily want to pay you. Can be frustrating. And if you're thinking about going to private practice, you have to recognize that this is a business you're running. So if you don't like running businesses, that's what it is. I think a lot of people have this romantic idea of having a nice little office, which I do. But at the same time, there's taxes, there's insurance, there's other liability issues, there's marketing, getting a caseload. People aren't just going to show up at your door. They've got to find a way to find you. So there's a lot of aspects to that. Are you going to be a sole proprietor? Are you going to have a corporation? And all those have tax implications. So it can get a little hairy, and you're going to need probably advice and counsel from a lawyer, an accountant, and maybe a bookkeeper as well. So I don't want to discourage anybody, but I want them to recognize some of the day-to-day duties that are going to be required of you if you want to run your own business. And let me go back and talk about a little bit about different areas in the field. So like I said earlier, I'm a clinical professional counselor, but there are also master's level drug and alcohol counselors that can do what we call dual diagnosis. So let's say you have a client that suffers from depression and a substance use disorder, and the two are kind of playing off each other. You'll be able to treat those. Marriage and family therapists, whose modality would typically focus on marriage and the systems within families that cause pathology, behavioral problems, interpersonal relationship problems, and then licensed clinical social workers. Those 3 or 4 disciplines almost do the same thing, but they use different theoretical perspectives and different techniques and interventions to get there. But I will tell you, for example, when I worked at the hospital for individuals suffering from major psychiatric disorders, we would work alongside one another. We would all be peer therapists. So we would do the same job basically, and we would handle it a little bit different because our specialties were a little bit different. And the hospital administrators would tend to try to match our specialty and our skill set with the patient's issues if they could. Other times we didn't have that luxury and we just had to do what we had to do. So if you're thinking about becoming a mental health provider, they're sorely needed in Nevada. It's a great career. While there's a tremendous amount of schooling, it's very rewarding. And I think a lot of people find it something a way of giving back to the community and helping, and that's therapeutic in itself. Because when you're faced with the reality of what's going on in the world, in our society, when you know you're doing something about it, that alleviates a lot of internal angst, because you think, well, what can I do? Or why is the world this way? Well, you have an understanding of that. You recognize people's problems. You get to know them in a very deep, intimate way. I know some of my clients better than their family members know them. While it's a therapeutic relationship and I can never be their friend, or we do share a very special bond. And I have clients for years, and sometimes they just come in once a year for a tune-up, that they call it. They say, I just got to know that you're here, because the experiences we have and the safety and sanctity of a therapy session is very powerful and life-changing. And the other aspect is that it changes you in ways that you didn't anticipate. You thought, I'm going to help people, but in other ways you become stronger, more resilient. You tend to advocate for other people because you realize it's not just individual care, it's society needs changes in order just to maintain its health and vitality, and without those things we're all at risk.